Hello, I'm Angie. I'm here to do an assessment on you. And can I get your name and date of birth?
McMillan 2209.
And I'm going to wash my hands, provide privacy, and check the doctor's order. And can I get the main reason for your visit today?
I check out.
And do you have any allergies?
No.
And are you having any pain?
No.
And patient is here for patient's skin color is pale, and there's no lesions or jaundice. Hair is evenly distributed, and skin temperature is warm, and no signs of dehydration. Hair is evenly distributed. There's no tattoos, ulcers, and body appearance is he's relaxed. Bun grooming is normal for the weather and temperature, and hygiene is appropriate. And do you know where you're at today?
The hospital.
And do you know what day it is?
11, 29, 21.
Okay. And facial expressions are appropriate, and speech is mood is patient is oriented to place and time, and thought process is understandable and logical. Mood effect is normal for age, and I'm going to expect your head and your face. Is that okay? There's no lumps, bumps, or lesions on your head. Your hair is evenly distributed and it's brown. And I'm gonna feel here your TMJ. Can you open and close? Okay. No TMJ. That's cranial nerve number 5. And can you puff out your cheeks and smile? Raise your eyebrows. That's cranial nerve number 7. And I'm going to look at your lymph nodes now. It's preocular, postocular, occipital, gastric, deep cervical, posterior cervical, submandibular, submental, supraclavicle. And then I'm going to have you turn your head like this and looking for jugular vein distension, and there's no signs of that. Then I'm going to look at your carotid arteries and just feel for a pulse here. Okay, good. And then on this side, okay, good. +2. And then I'm just going to listen for breweries with my bell. No signs of breweries. And then your thyroid glands are right here next to the trachea, and their midline right here. And no masses or lesions. And then some range of motion. Can you put your hands up like this and down and go around like this? And then can you shrug your shoulders and then push down, push up? And then can you tilt your head like this? Okay, cranial nerve number 11 is intact. Okay, next we're going to look at your eyes. Do you wear glasses?
No.
Okay. I'm just going to shine a light in your eyes and look at your pupils. Pupils are round and reactive. I'm going to look into your sclera conjunctiva, and it's pink and white. Pupils are about a 3. And then I'm just going to have you follow my pen light, and they're accommodating, and then follow in 6 cardinal days. Pupils are equal, reactive in accommodation to light, and that's cranial nerve number 3, 4, and 6. And then have you do like a reading test, a little reading test. I got to grab something for you to read. Oh, here, we'll have you just read this. Can you read what this says? Okay, that's cranial nerve number 2. And then next we'll have check your ears. Do you have any hearing issues?
No.
Okay. I'm just gonna look in your ears and check for any drainage or masses. No drainage or lesions. Okay, and is there any pain? Any pain here?
No.
I'm checking the tarsus, penis, and the mastoid process. And then I'm going to do a quick hearing test. I'm going to go behind you and say 3 words. Can you repeat that?
Light, tight, dynamite.
Good.
Light, tight, dynamite.
That's good. And that is cranial nerve number 8. That's intact. Next, I'm going to look into your mouth. Do you have any problems chewing or swallowing?
No.
Okay. I'm going to have you open up your mouth real big for me. Okay, all your teeth look like they're intact. And your lips are pink. Stick out your tongue and say ah. Go ahead. No tonsils. You've had your tonsils taken out?
Yeah.
Okay. Lips are pink. Teeth are all there. Hard palate is pink and moist. Mucosa is pink. Uvula, say ah. Is good. And tongue is moist. Cranial nerve number 12 is intact. Excuse me. And then next is your nose. Do you have any problems smelling anything?
No.
Any problems breathing?
No.
Can you go like this and see? And then this side? Okay. Now I'm just going to look up your nose. And I don't see any drainage or anything. Your nose is no deviation, no drainage or anything. Can you close your eyes and I'm going to have you smell something? Can you smell? Do you know what it smells like?
Alcohol.
Okay, good. That's cranial nerve number 1. And then the next part, I'm going to inspect your chest area. And it doesn't look like you have any heaves or lifts. Are you having any chest pain?
No.
Okay. I'm just going to, can you just kind of sit up tall for me? Can you move your hand? No breathing with the accessory muscles. Just gonna feel here. No lumps, bumps, or bruising. I'm just going to percuss over your lungs. Okay. Now I'm going to listen. And the aortic, pulmonic, Erb's point, tricuspid, mitral valve, S1, S2. And the right is rhythm is normal. And then I'm gonna listen to the back. You just kind of turn sideways a little bit. There we go. Your AP diameter to 2 to 1. Just gonna palpate. And then can you say 99?
99,
99?
99,
99?
99,
99?
99.
Okay. And then I'm just gonna listen to your lungs. Okay. And the tectoriformis. Okay. And then next we're gonna talk about your stomach. Do you have any bowel problems, like problems going to the bathroom?
No.
What about urinating?
No.
And history of surgery?
No.
Okay. And then can I have you like laid this way on the, if he'll let you? Scoot down a little bit. Okay, your stomach is flat. Your umbilicus, I gotta show you something, is introverted. There's no bulging or masses. There's no pulsation or distension of veins. And I'm just gonna listen to your bowel sounds. Okay, you have normal bowel sounds. Oh, and then I'm just gonna listen to your the bowel. The aortic, ileus, femoral. Move your hand for a minute. And femoris, iliac. Okay. And hold on. Any pain?
No.
And then cuss. No pain?
No.
Okay. Okay, you can sit up. Okay, and then next do you have any problems with your lower extremities?
No.
Okay, I'm gonna have you stand up and walk this way and then walk back. Why are you walking from me? Okay, your gait is normal. And I'm gonna have you put your feet down. Push up with your feet, like you're pushing, like a pedal. Both of them. Now push down. Okay, and then there's no edema. And then no edema on the legs. Skin is warm to touch. Oh, and then back out. Feel your pulses. Good. Good touch pulses there. Brachial touch pulses here. And then tell me if you feel dull or sharp.
Dull.
You feel this? What is it, dull or sharp?
Sharp. Dull. Sharp.
Okay. Oh, stand up. I gotta do one more test on you. Put your feet together and close your eyes. Put your hands down. And a good Romberg test. Okay, sit down. And then close your eyes again. Grab this one on your face. Dull or sharp?
Dull.
And then the pulses, pedal pulses on the feet are +2, and dorsal brachial pulses are +2, and or post-tibial pulses are +2. I mean, and then we did. Can you squeeze my fingers? Real tight, tight, tight. Good. And then take your finger and touch my, okay? Touch your nose, touch my finger, touch your nose, touch your fingers. Okay, good. And then take your heel and slide it down here. Okay, good. Good range of motion. And then I'm gonna check your, did you feel that?
Yeah.
Did you feel that? Okay. Alright, and then go like this. And go like the range of motion. And up like this. And go like this. Okay, good range of motion then. And then to end our assessment, we're going to talk about good hygiene. You have to make sure that you have good hygiene, especially right now with COVID. You want to make sure that you're washing your hands every day and throughout the day to make sure that you don't pass on the COVID, okay? Okay, thank you.